All right, so constantly running to the bathroom, that annoying dribble after you finish, wiping up little leaks throughout the day, and dealing with a stream that barely has any force behind it. None of that has to be your permanent reality. Getting to know your prostate and understanding just how critical it is to your entire well-being is the real secret to taking back control of your sexual health and your urinary function. Now, as a functional medicine physician, I've personally witnessed the devastating effect that poor prostate health can have on a man's quality of life. I've seen my own father struggle with it. I've guided countless patients through it. And the truth is, a huge number of men start running into erection problems after they hit 40. And more often than not, the prostate is the hidden culprit driving those issues. That's exactly why in today's conversation, we're going to take a deep dive into this tiny but incredibly powerful gland. And more importantly, I'm going to walk you through a remarkably simple and effective technique you can use to strengthen and support your prostate health from the comfort of your own home, starting right now, today. Whether you're already noticing prostate symptoms or you're simply being smart about prevention, knowing what the prostate does and how to keep it in top shape is absolutely critical. So let's jump right in by first understanding why the prostate matters so much and what kinds of warning signs your body might be sending you if it's struggling. Let's take a second to picture exactly where the prostate sits inside your body and why its position makes it such a big deal. Now, if you look at the diagram I've put up on the screen, you can see the prostate shown as a small, round structure sitting right in the gap between your bladder and the base of your penis. So just its location alone tells you how important and strategic it really is. It basically works like a command center, directing all the signals as they travel down toward the erectile tissue. And when I talk about signals, I'm talking about nerve impulses and blood flow. The prostate is genuinely vital because so much activity passes around it and directly through it. It's also sitting right at the intersection where your urinary system meets your sexual system, which is exactly why it plays such an enormous role. Sitting above it is your bladder, below it is your penis, and your ability to get and maintain an erection. And what you absolutely need to keep in mind is that as that prostate begins to grow and increase in size, it actually starts to squeeze and interfere with the nerve signals and the blood flow trying to reach their destination. Now, when the prostate starts to get bigger, it begins to pinch off the urethra, that narrow tube that carries urine out of your body. Urine starts up in the bladder and is meant to flow straight down and out through the urethra without any resistance. But because the prostate is swelling, it puts pressure on that thin, straw-like passage, and urine starts pooling back up in the bladder. That's the reason you're sprinting to the bathroom so frequently. The urine is sitting in your bladder much longer than it should because it's essentially trapped in there. Now let's discuss BPH, which stands for benign prostatic hyperplasia. This is an extremely common condition where the prostate gets larger as you get older. Here's another illustration for you. On one side, you'll notice a normal-sized prostate with a urethra that's completely open and urine passes through without any trouble. On the opposite side, you'll see a swollen prostate that's pressing in on the urethra, making it really tough for urine to get through. This squeezing doesn't just affect urine flow. It also makes it harder for ejaculate to pass, and it disrupts the nerves and the blood supply that are essential for achieving an erection. And as the prostate keeps expanding and occupying more space, those nerves that run along its sides, the ones that are supposed to travel down into the erectile tissue, start getting compressed. They can't do their job the way they once did. This is precisely why BPH and erectile dysfunction so often show up together. They go hand in hand. And if you're currently dealing with prostate problems but haven't noticed erection issues yet, I'll be straightforward with you. It's really only a matter of time unless you get ahead of it. So, as you can see, maintaining a healthy prostate isn't just about fixing bathroom problems. It's equally about protecting your sexual function. The prostate may be small, but its influence on a man's daily life is massive and lasting. Keeping it in good shape is absolutely essential if you want to achieve firm erections and maintain them throughout intimate moments. So let's move past the anatomy lesson and get into what you can actually do about it. Let's talk about a proactive, natural approach to supporting your prostate health called an external prostate massage. Now, before you click away, I need you to hear this. You don't have to insert anything anywhere. And honestly, You can do this with all your clothes on. You don't need to undress. It's not that kind of massage at all. This technique has been supported by findings in multiple research studies, and I want to demonstrate today how you can safely make this practice part of your routine using something you probably already have lying around the house: a tennis ball. Yes, a simple tennis ball. Prostate massage has actually been used for a very long time to address various prostate-related conditions, well before modern medications ever entered the picture. In fact, physicians used to routinely perform prostate massage right in their offices when men came in complaining about erection difficulties or prostatitis. Prostate massage was literally their go-to treatment. The practice goes all the way back to an era when doctors focused on natural, hands-on therapies rather than simply handing you a prescription. As a matter of fact, a significant study published in the Journal of Urology and Nephrology confirmed that consistent prostate massage led to meaningful improvement in prostate symptoms. So it's honestly surprising that more people aren't talking about this. Now, using a tennis ball to perform a prostate massage is a brilliant little trick I picked up from a close colleague of mine, wellness coach Marcus Williams. The tennis ball is perfect because you can find them absolutely anywhere. The most effective way to activate your pelvic floor muscles and give the prostate the stimulation it needs to help flush out built-up toxins and get that stagnant fluid moving is to grab the ball and find yourself a very firm, flat seat. Just a solid chair where you can sit comfortably with the ball underneath you. Next, take the ball and locate that spot halfway between where your testicles end and where your anus begins. Some folks refer to it as the perineum. You're going to place the tennis ball right on that spot on the chair seat, and then you're going to carefully lower yourself down onto it. Once you're sitting on it, grab hold of the armrest for balance, and then gently begin rocking forward and backward. You'll feel the ball gliding back and forth between where your testicles end and where your rectum begins. Just roll gently and steadily. What's happening is that you're applying pressure to the external surface of your prostate. Now here's the next part. I want you to adjust how much weight you're putting on it. Add a little more pressure gradually. Shift your body gently forward and back. This should feel like firm pressure but should never be painful. You're essentially performing a deep tissue massage on yourself. So don't just drop all your weight onto it and start rocking aggressively, because you could end up with some serious irritation down there. Just move slowly and gently back and forth with control. The whole point here is not to cause discomfort. The objective is to maintain consistent, steady pressure so that you're working both the pelvic floor muscles and the prostate simultaneously. Now I want you to check out this message from a patient of mine who did exactly this. He followed my straightforward guidance about the prostate massage using the tennis ball technique. Now, prostate massage can develop into a more detailed practice over time. You can graduate to using a dedicated prostate massager for the external work, or you can use one designed for internal use, which gets you as close to the actual prostate as physically possible. But if you're just getting started, begin with the tennis ball. Start with roughly 5 minutes per session, once a day, about 3 to 4 times per week. And of course, always check with your doctor before starting any new health practice. Get comfortable with how it feels first. My colleague Marcus keeps a tennis ball in his desk drawer at all times and never travels without one. The idea is simple. If you always have a tennis ball within reach, you can work in a quick prostate massage session during your downtime, and it naturally becomes part of your regular maintenance routine. Making this tennis ball technique a consistent habit can potentially help ease the symptoms of an enlarged prostate, boost blood circulation to the entire area, and support improvements in both your urinary and sexual health. Go pick up a tennis ball today. Drop a comment below and let me know how it's working for you. And I've put together a free resource on this exact topic. It's pinned right there in the comments section. All you have to do is click on it, enter your email, and we'll send it straight to your inbox. So smash that like button, share this video with someone who needs it, grab your tennis ball, keep me posted on your progress, and I'll catch you in the next one.